Okay. All right. Thank you, everybody, for joining us this evening. My name is Jennifer Lombardo. I'm our community relations manager in our marketing department here at Rothman. I wanted to introduce Jessica Kempa. Jess is our athletic trainer here at Rothman, and she's going to be moderating tonight's presentation. So, Jess, you want to take it from here?
Sure. Hello, everyone. And again, thank you for joining us tonight for our return to sports activities and exercise after the pandemic. I hope everyone's doing well. And again, as it's been said, just a reminder to please keep yourself on mute so that there aren't any distractions. As Jen said, we are recording this and it will be emailed to everyone tonight or after tonight so that you'll have it for future reference. Tonight's presentation is going to be a little different. We asked for your questions at registration so we could gear things to what you really want to know. So instead of a traditional lecture, we're going right to the questions. So thank you to everyone who did submit. Dr. Stache has reviewed all of them and has tried to cover as many as possible in our Q&A. We are limited to more broad and general questions. So for anyone who submitted more personal specific questions, we urge you to schedule an appointment to meet one-on-one and be evaluated by Dr. Stache or one of our other physicians. Also, due to our format and the size of our audience tonight, we are limited to the questions that have been previously submitted. Unfortunately, we will not be able to answer questions asked live tonight. So tonight's tonight's presentation will be given by Dr. Steven Stache, and just a little background on him. Dr. Stache is a non-operative sports medicine physician who treats a wide variety of athletes and non-athletes. He completed his fellowship and residency training at Thomas Jefferson University Hospital and obtained his medical degree from Jefferson Medical College. He is board certified in both sports medicine and family medicine and has a particular interest in concussion management. Dr. Stache serves as a team physician for a variety of sports teams on the professional, collegiate, and high school level. Originally from the Pittsburgh area of southwestern Pennsylvania, he was a former collegiate athlete, playing 4 years as a starter in football at Johns Hopkins University. And lastly, my name is Jessica Kempa. I am a certified athletic trainer. I went to Newman University for my undergrad in athletic training. While there, I also was a 4-year starter and all-conference soccer player. I then completed my master's degree through Concordia University of Chicago. I've been an athletic trainer from the middle school level to Division I, and I've been with Rothman Orthopedics for almost 7 years now, and I am currently the supervisor for athletic training services for Pennsylvania. So that's a little on us. So I guess Dr. Stache will get right at it, huh?
Sounds great.
Okay, so my first question to you, what exactly is a sports medicine physician, and how do you differ from an orthopedic surgeon?
That's a great question. Just a couple real brief things. I realized when we set this up, we chose for the terms after the pandemic. It really is still kind of during the pandemic, but I think everything that we're going to talk about is obviously still applicable. And just one comment, we tried to there were some questions in the ones that were submitted that kind of covered similar topics. So we folded them into similar questions. So if you don't hear your name or your specific question, I did my best to kind of roll that in. So thanks again for everyone joining tonight. It's nice to be able to speak without a mask on my face and do so safely. So a sports medicine physician essentially is a musculoskeletal specialist. The way that things were described to me when I was in medical school is in orthopedics for many, many years, the triangle, if you will, of or hierarchy of referral is kind of on the upside down, where in the past the patient has an injury, they go to their primary care doctor, but often they enter into the system directly to the topmost specialist, which here at the Rothman Institute is a fellowship subspecialty trained orthopedic surgeon. Sports medicine physicians enter at that mid-level where we have more training than a primary care doctor, but are not as subspecialized with orthopedic and surgical training as a surgeon. So a parallel would be considered a neurologist to a neurosurgeon, as in sports medicine compared to an orthopedic surgeon. So that's kind of how I describe it. Our perspective as non-surgeons is to really focus in on all treatment options and evaluate problems. I consider myself a diagnostician at heart, where I'm presented with a series of complaints or issues with different joints or different dysfunction, and then being able to differentiate between orthopedic anatomic conditions, orthopedic functional conditions, and then developing a treatment plan. About 80% of what comes through the average orthopedic office is a non-surgical problem. So we also at the Rothman Institute kind of serve as a filter for the system, where we can handle a lot of things that patients have and help them get better without having to really consider the aggressive surgeries or things that would require a lengthy recovery. I think the system works very well here, and I think part of what's made the Rothman Institute very successful and allowed us to expand throughout the Delaware Valley is to have this fundamental means of evaluating patients and handling not just surgical care, but total musculoskeletal care.
Awesome. So what services are currently operating out of Rothman Orthopedics? Are the telehealth appointments still available? Is physical therapy available?
Yeah, that's a great question. So earlier in the pandemic, we were pretty quick to implement telehealth, and there are still some providers that are offering telehealth appointments. I got to be honest myself. I have moved away from that just because of the sheer demand of patients coming back into the office. I think you have a couple of different groups of patients that are being seen. You have the people that are coming in for their regular care. You have the individuals that are experiencing new problems or orthopedic injuries. And you have the patients that waited the entire time of the quarantine that now are coming in. So it's been really busy. Some of my colleagues are still doing some form of telehealth, but the primary mode of treatment now is back into office care. We are following all of the CDC guidelines for appropriate social distancing. We've made a lot of changes, as I'm sure you've seen at other grocery stores with plexiglass paneling. Chairs are spaced out in the waiting rooms. And we really do our best to minimize unnecessary contact. All staff wears masks and or shields, gloves everywhere, hand sanitizer so much that it makes my nose sting every moment of every day. But we are fairly close to normal operations as far as services that are provided. Not all of our offices are at full capacity or back up to complete function, but an overwhelming majority are. There are physical therapy services that are back, as are orthotic services for braces and different medical devices. So we're pretty close to normal from our day-to-day operations.
Awesome. I'm sure it was hard with the telehealth, not being able to get your hands on the patients. So I'm sure you're happy to get back into that.
You had to get pretty creative. I found myself asking patients to go fetch weights or objects to be able to move things around to assess whether their joints could handle different challenges. So it was learning on the fly for a lot of people.
So are surgical services running normal with the COVID-19 pandemic still present in the community?
Another great question, and the short answer is yes. We have a lot of different surgical centers and a lot of affiliations with different hospitals. So different hospital systems have different requirements, but we are able to adapt, and we are again pretty close to full capacity as far as what we're doing. If you are considering coming for a consultation and you have a surgical condition, our schedulers can streamline that. I can tell you that COVID testing is absolutely essential for pretty much all facilities. So, and that would be a new COVID test. You wouldn't be able to bring something with you. That can be a delay in care. And so it's really important to be compliant with the recommendations and understand that we're all trying to do the best that we can, but we're living in a world that is a brave new order. And if we work together, we can definitely get all the care that's needed. But absolutely, our surgeons are back up and running and doing everything that they have been trained to do.
Awesome. That's great. So this next question hits near and dear to my heart as an athletic trainer. And a lot of things have started to change just this past week. A lot of the local schools are currently deciding on when athletes can return back to sports and return to their true in-season status. I know a lot of athletes have been playing lately, but not in-season competitions. Do you have any insight on the safety of playing sports during the pandemic restrictions?
Yeah, that's a really, really complicated question. And Governor Wolf in Pennsylvania had the restrictions kind of divvied down to the individual schools. There was a veto that was passed, and then the House kind of kicked it back. So schools now have the power to decide. I know in the Central League, which is a majority of the schools that we take care of or involved with in Pennsylvania, I believe are deciding tonight. I know Radnor, where I'm the team doctor, I believe the school board meeting is tonight. From what I've gathered, non-contact sports are going to be prioritized, so cross-country, tennis, other sports where social distancing can be maintained. But, you know, as is everything in the COVID world, this is a rapidly evolving situation. So we now have our first outbreak in the NFL with the Tennessee Titans and the Minnesota Vikings. So I think that might sit a little bit differently in some of our parents and administrators. Football is certainly a big discussion, and I have heard mixed messages that some schools are really pro football while other schools are not. I do think the inherent nature of contact increases the risk. We know that contact with surfaces, not so much, but contact with humans, and where, you know, sweat is flying around and people are literally running into each other, there is definitely an increased risk. And I think the hardest part is that we know that younger individuals themselves are not at risk, where they are not immune. They are not without their concerns. There's evidence, and there's a question later about the risks of cardiac issues and other things after infection with COVID, even if you're asymptomatic. And so it's not something that should be taken lightly. And I think all parents need to really consider risk and benefit. I cannot imagine what it's like to be an athlete right now, particularly seniors that might have implications for the future on the line with scholarships or being able to go to schools that they may not have access to. So everybody in the community I know is really trying to make it happen, but this problem is not going to go away. And as we're seeing at colleges and universities, young people are leading the infection numbers right now. You know, in the state of Pennsylvania, Centre County, where Penn State is by far and away leading the infection rates. So it's definitely something that, or there's pluses and minuses on both sides of the column. 6 or 8 weeks ago, when the numbers were still higher and infection rates were trending kind of parallel and not down, a lot of the schools appropriately decided, let's delay. Governor Wolf made the recommendation to delay indefinitely through 2020. And, you know, as a physician, I have to say that if I were pressed to make the decision, I think that is the most appropriate. But as a former athlete and understanding mental health, I think there is a safe way that things can be done, but it's going to have to be adaptive and it's going to have to respond. I will also say that, and I've said this long before the pandemic ever existed, when it comes to the act of participating in sports and athletics for students, it's student-athlete, not athlete-student. So school comes first. So most of the school boards that are going to discuss this have already made the decision to either return back to full-time school if they're not already doing so, or some sort of virtual hybrid model. I think it's really important that as caught up as we are as a society with sports, education has to be the priority, and allowing our students to go back and be safe so that they can learn and contribute to society with their education in the future is the definite priority.
Okay. So as our athletes are transitioning, again, whether it's the full seasons or non-traditional practices, what kind of resources are available to help the student athletes as they transition back to school sports?
Yeah, so I would say first and foremost, parents should be the best resource, right? They know their children and they're there. I always encourage dialogues to my patients and their parents. If a parent doesn't understand what a patient's going through mentally, emotionally, and physically, it creates a really significant strain and it makes my job harder. So parents, please talk to your children during this time. It's vital to their health and to yours. On the school level, one of the individuals that I like to champion every single day, Jess, is you, an athletic trainer. They're a very important part of the team when it comes to sports medicine, and you're really the boots on the ground. Almost every school that I know in the area has at least one, if not two or more athletic trainers. Colleges have a whole staff. Professional organizations have more athletic trainers than you can throw a stick at. But they are the front line. They are there to advocate for the athlete's health and well-being. Every single day that I have an athlete that has an injury, I tell them, listen, if you don't know who your trainer is at your school, you have lost your best defender. You should never have to explain to a coach why you can't participate or why you're concerned about your ability to participate as an athlete. You have an athletic trainer. That's their job. That's what they're there for. They're there to help you. You should not be afraid to communicate with that person. And then that person can in turn coordinate with myself. You know, at Radnor, I have my colleague and friend, Kevin Schneider, who I communicate with like literally every day, in season and out of season. So there's nothing that doesn't happen that I can't either help guide or give some level of supervision and then coordinate with parents to really provide athletes the care. And I think that it's something that parents don't always know about, that is there. There's a lot of, is the athletic trainer acting in the best interest of the athlete or the best interest of the school? And that's always a problem at every single level, particularly at the professional level, where there can often be mistrust with organizations with regards to contracts. But athletic trainers, by definition, are there to be part of the care team and provide care for the patient. Yes, I'd really like to hear your experience since you've been involved. I think one of the other two areas that are not really talked about is also clinical care. My assistant in the office is an athletic trainer, which I think gives a really helpful skill set. And then, Jess, you're also part of our administrative and supervising team so that we can understand what the needs are for our athletic trainers. So I'd like to give you some time to speak if you want.
Well, just to piggyback on what you were saying, the athletic trainers, we're the middleman. We're the middleman for everything, from the athletes to the coaches, to the athletic directors, to the doctors, to parents, and really about anything. It's, obviously we're there for sports and we're seeing sports injuries, but there's a lot of stuff going on due to the pandemic. And, if you just need somebody to talk to, every athletic trainer I know, and that was, one of the great things is just getting to talk to my athletes. And, if you're having a bad day, if there's something going on, we're here. It's not just sports related. And I think that's a big thing. We're neutral. We are healthcare providers. We work for the school. We work at the school. We want the sports teams to do well. We love going to championships. Not always in the middle of winter, football's a little struggle sometimes, but, we love seeing everyone do well, but at the same time, we are for each individual athlete. It doesn't matter if you're the star athlete, if you are just someone out there having fun and doesn't get, a whole lot of playing time. It doesn't matter who you are. We treat you all the same. Your health and well-being is what's most important to us. And I think it's tough now because there's a lot of club sports that have been going on. So there's some kids that have been playing sports. There's some athletes who haven't been playing a lot. So, as the sports transition back, I think there's going to be a lot of different levels of being in shape. And I think some athletes might be feeling a little different than they usually do at the start of the season, because the start of the season usually was a couple months ago. And like you said, I think it's important to know your athletic trainer. If you're feeling, something sore, you're questioning something, talk to your athletic trainer. Sometimes it could be nothing. Sometimes it could be, something. And, we'll go through all the processes. And the nice thing with also having athletic trainers, we have those relationships with our physicians that I know a lot of athletes are always worried that as soon as you talk to someone, you're going to get shut down. But I think that's one of the good parts about having an athletic trainer, is that we're there seeing you all the time and we can monitor you. So, I would say that there's very few times that there's 100% you're shut down, no go. And generally when that happens, you kind of already know that's going to happen. It's not just you and the physician relationship where, Dr. Stache, you don't get to see the kids all the time. But with our relationship, we can let you know, this is how they did today. This is how we did today. Can we move him forward with this? Do we need to back up? So, I think that's, like you said, get to know your athletic trainer.
There's two comments that I would make that you made me think about. One is when I was in college, I didn't get any care through any other venue than through the athletic training office. So if I got sick, I went to that training office first, talked to my trainer, like, what do I need to do? How do I approach the university health system? Do I need to go see someone? Do I need to have a strep throat test? So, they're, as you said, your healthcare professionals. And my challenge to any parents on this call, one of the situations that might happen through the fall, if fall sports is not formally sponsored, is the continued voluntary workouts. I think it's important that our athletes stay active and be healthy. We don't need to go through all the benefits of physical fitness. That would be a whole separate talk, but there's so many benefits. And if athletes are gathering and participating together and the school is providing services, I think it's important, parents, do you know if the school is having their athletic trainer there? If they're not, then I would be advocating to your administration, like, who's looking out for the health and well-being of our kids while they're there. Coaches have the best of intentions, but coaches aren't healthcare providers. And so I think that's a really easy ask to school boards. Are our athletic trainers there on the site to be there like they normally would, right? We're trying to live some level of a normal life in this abnormal time. And so if your athletic trainer is not there, school boards have the power to make that happen. So reach out to your school boards and make sure that athletic trainers are doing what they do best.
Awesome. Okay, so I lost my list here. So what are some common mistakes athletes and active individuals might make as they transition to other forms of exercise and activities due to COVID-19, or as they've ramped back up after being inactive for quite some time?
Yeah, what a really common problem right now. There's kind of a couple different groups. We have the group on the extremists that didn't do anything, right? They totally quarantined, whether it was because of health concerns or just, this is what we were being told to do, and they stayed inside and they didn't do anything. And then all of a sudden, hey, it's free. Moving forward too quickly and expecting that you can return right back to the level that you were prior to inactivity is a recipe for disaster. If a 4-minute marathoner, or not a 4-minute miler, breaks their ankle, when they recover, they're not going right back to running a 4-minute mile. They're going to have to work on reconditioning, easing their way back in. So I think that's a really important concept, is in understanding that a gradual return is going to be better. I'm also a firm believer, and I guarantee I'll say it multiple times if it comes up, diversification, right? Participation in fitness should be like finance. If you're investing in one area, you're accumulating risk. You may accumulate massive wealth, but something goes wrong, bad things can happen. When it comes to exercise, it's really important to do different things. I talk to runners all the time who only run. I call that mono training. You're exercising the same muscles in the same manner all the time. It's great cardio, good calorie burn, but that chronic repetitive activity can absolutely increase the risk of chronic repetitive injuries. You can get muscle balance shifts that you're not even perceptive of over time until it's too late. I really break exercise down into 4 categories. Cardio, which is obvious, running, elliptical, biking, anything that can really get your heart rate up. For our more wise individuals that have age as a concern, walking is often the main form of cardiovascular activity because you can get your heart rate up. And that's great. Even if you have arthritis and you have pain, I'll never tell you not to walk. But walking alone is not enough. That's one of my taglines. I literally say it every day. You need to do more. And being able to say, I'm doing other things than walking, you're supporting your body, you're spreading that risk to other areas, engaging your muscles. So next form is strength training. And this isn't going to the gym. If we can talk about that in a minute, I'm sure it's going to be a question. But engaging your muscles in a manner that's aimed to stimulate building strength. Something as simple as standing and rising from the chair and repeating that over and over again for someone who has arthritis could be enough to challenge your leg muscles in a different manner that can add to strengthening and stabilizing a joint. And so that's really important. You can use resistance bands. You can use body weight. It doesn't have to be the old school throw around weights, Arnold Schwarzenegger style, the way that I learned when I grew up. Flexibility is number 3. And there's a wide variety, and by far, as we age, this is the most commonly overlooked area. We're talking about things like yoga, Pilates, something as simple as developing a stretching routine. Tai Chi has strong evidence to suggest that it can improve balance and coordination and aid in arthritis-related pain. So if you're not engaging in these activities, you're missing an opportunity to improve your body's function. So again, cardio, strength, balance, and the last is recreational sports. And if you're really not working on the cardio, strength, and balance, recreational sports, even something as simple as golf, I shouldn't say simple, as straightforward as golf from the concept can become dangerous. For all of our racket sports out there, I love pickleball. Pickleball pays the bills. So if you're playing pickleball and you're not really focusing on some of the other things, that's a sport that will get you into trouble very easily. So again, cardio, strength, flexibility, super important to balance all 3.
Awesome. So is it safe to return to the gym?
Yeah, there were multiple questions about the gym. I'm going to break it down in 2 different ways. I'm going to give you some of the concept of the risk, and then I'll give you my personal opinion. So we know that the risk of acquiring COVID is greatest with direct contact, right? So masks and limiting direct contact, social distancing, right? So social distancing is greater than 6 feet, and prolonged exposure is greater than 15 minutes. So a lot of gyms have worked really hard to try to space things out. In most cardiovascular areas, treadmills, every other one is blocked off. Every other bike is blocked off. But from the gyms that I've been to, most of the fitness equipment is bolted to, thus cannot be moved. You're also going to go from machine to machine and either touch the machine, or you're going to pick up weights and put them back down again and have to transfer them. So that's direct physical contact, right? Inherently increases risk. Now, when I was still going to LA Fitness, let me rephrase that. When I tried to go back to LA Fitness more as an experiment just to see what they were doing, this is not a shot against LA Fitness. This is just what my personal experience was with one gym. I think they did a pretty good job where when you walked in, you got your own spray bottle and you got instructions to walk around and spray after yourself every time you touch anything. That's a really hard thing to ask a person to do. It's a challenge to do here in a medical office where everywhere you go, you're spraying everything that you touch. So just being in that environment where there's shared machines and other devices does potentially increase your risk. And what it really comes down to, one of the concepts for COVID in general is, what kind of risk are you willing to accept? There are plenty of individuals out there that are anti-mask and seem to be willing to accept more risk. This is not a political discussion, but what we know and what we have learned is masks work. They can reduce the risk of transmission. It was one of the easily implementable things that helped flatten the curve in the Northeast back when the restrictions were put in place. If you look at what we learned from the spikes over the summer when restrictions were released, people were about coming into social contact with each other. The questions of effectiveness with masks came up, and in areas where it was demonstrated where masks weren't being used appropriately, there was increased risk. So the short answer is, yeah, you can go back to the gym if you want, and if you think it's important for your lifestyle and activity, then you need to arm yourself with the knowledge to take the appropriate precautions. For me personally, so now we're moving to, I did not think it was worth the risk. I went once, I observed what was happening. I looked at the services that were not being provided, like being able to get a shower. I usually would go to the gym before I went to work in the morning. And this is not something that was compatible with my lifestyle. So I canceled my membership. My family and I regularly went to the YMCA for not only fitness-related activities, but also social interaction. Our membership is on hold through January. So, for my wife and I, who is also a healthcare professional, and, it's not a matter of exposure because we're confident that just through what we do, we've been exposed. It's just a matter of, can we change that risk burden, not only for ourselves, but others by not going? And the clear answer was yes. So we're not going. Beyond that, there are plenty of ways to get creative. Adaptation is the father of ingenuity, or however the term goes. In the early part, I found myself doing things that I've never done before, doing it smartly and doing it wisely, but being able to explore different forms of physical activity. And so I think if you're creative and you're being smart, like, you can figure out other ways to get forms of exercise that aren't necessarily at the gym. Last time I checked, particularly in the summer, roads are available to run wherever you want. So while I myself am a treadmill guy, you can go run outside. And there are plenty other things, stationary bikes, riding a bike. I wish I had invested in Peloton or Echelon. Man, those stocks are booming. So you can take advantage of other resources that isn't necessarily the gym. But at the end of the day, if you want to go, just know the risk that you're taking.
Well, even I think it's kind of cool. I like, I know it's hard not going to the gym if you're doing a lot of free weights or the machines, but a lot of the gyms have had their classes that they do virtual. So doing the yoga classes virtual, or even, cardio classes, or, other things. I know a lot of my friends have been able to still, be part of that gym environment, but, staying home if they felt that that's what was in their best interest. So I think it's kind of cool with the virtual aspect too.
Yeah, and that's not too different from other facets of adaptation, right? Like, telehealth is an absolute adaptation to not being able to come in direct contact. What we're doing right now, I've given more lectures than I can count. And prior to COVID, they were all in person, and me standing up, being a talking head and pointing at things. Now I'm doing this, which I think is still an effective manner of reaching the community and answering questions. So we're all adapting. And that's something that I said earlier. There will be two groups of people. There will be adapters and there will be non-adapters. And the adapters will be able to respond and persevere through this crisis.
Okay. So have there been any injuries that you've seen more frequently since the pandemic has started?
Yeah, interestingly enough, there have been. One of the things that I was really surprised was increase of something called frozen shoulder. And I directly attribute that to people not being able to seek care in a appropriate time. So frozen shoulder is a condition that happens in the shoulder where you can have any wide variety of minor injuries, just simply a muscle strain, and then you alter your activity because of the pain that injury will bring, and then the shoulder gets stiff, it responds, and then you have a whole nother problem on top of that. So that's something that I absolutely saw more of very clearly. Starting to stabilize a little bit because I think people are getting out and doing more, or certainly seeking care if they injure their shoulder. But I would say through the months of June through or May, when I was seeing patients, May through end of July, it was multiple ones a week, really, really impressively. So back pain, I think, is also up just because inactivity can negatively affect back pain or arthritis-related back pain. So I think that was an uptick. Also, one of the most common things that people seek orthopedic care for It's been a challenge kind of seeing the number of people that have come in. That's a classic setup where you haven't been active for a long time, and then you go out and do something in the yard, and whoop, there's your back. You get some pain, and you got some pain shooting down your leg. So I'd say, and those are two really important things, right? What's the common denominator between those two conditions? Inactivity, and then not seeking care. So if you're not being active, you're increasing your risk that your body's not going to respond when you do try to be active. And if you don't get out and seek the care, things get complicated. So my response to that is, it's okay to be active, and you should be active, but you want to do it smartly and effectively. And we are here to help. Please come in and see us if you have needs.
Okay. Yeah, I think I had frozen everything at one point in the beginning of this. So HIIT style exercises or high intensity interval training, like Orange Theory and boot camp, and CrossFit have become really popular forms of exercise recently in recent years. How does someone know if these forms of exercise are appropriate for him or her? And are there particular risks that go along with starting?
Yeah, it's a really great question. And you know, as someone who participates in these forms of activity, I'm very cognizant of it, and I'm entrenched in the CrossFit community, and I definitely have plenty of patients that I see. It's a big transition from traditional forms of exercise. You know, you're dealing with extremes in a short period of time. The idea is to get quickly intense. You have times where you can rest. And reaching those extremes, if your body is not prepared for it, is definitely a recipe for injury. And I can tell you that CrossFitters, shoulder injuries are probably the most common, just because of the sheer number of overhead activities that are there. So it all comes down to fundamentals to me for these types of activities. If you're not familiar with the exercises or the movements that you're doing, please seek help with your trainers or your coaches at these types of activities. You know, the places that are really successful, I think they employ really good trainers. And I think that it's a really good exercise. I believe in it. It gets back to that principle of diversification that I talked about earlier. I think Orange Theory is particularly good at kind of tapping into the idea. It's the execution that starts to matter. One of the things that I talk to patients about is the competitive nature of classes when you have data in front of you. When you can trend your heart rate and your calorie output compared to somebody that's in your class with you, it is human nature to try to do better. And that's what's really a big draw for these classes. That's where people get into trouble, because you think you understand the principles. You're looking at that monitor and you're seeing the data and you're saying, I'm going to push. I want to get more. I want to beat that guy or girl next to me. That's my competitor. And things happen. So you have to be very critical and understand what your body's capacity is. And also, you know, the unfortunate reality of age comes into play here. A 20-year-old is going to be able to handle more of a physiological stress than a 55-year-old. And we all like to believe inside our minds that we're still 20 or 30 or whatever number you want to pick, but you cannot deny that our bodies age over time, and that has an effect. And so if you're older, you're supposed to be wiser. I'd like to believe that for everyone, but we all know it's not true. So you have to take the time and look within yourself and say, can I reliably do this? And if I push myself, am I putting myself at risk? There's that concept of risk again. I'll take a moment, and I don't know if I spread this out specifically, but it's a really important concept of the understanding of the difference between comfort, right? When I was a kid, are you hurt or are you injured? That's what my father and coaches used to say to me. You know, discomfort is a sign that the body is working hard, and that's not necessarily a bad thing. Discomfort is something that doesn't stop you. You can have knee arthritis. You can have knee arthritis that causes pain. That pain can give you a sensation that tells you that your knee hurts. But if you can appropriately execute whatever it is that you're trying to achieve with that pain, it's not necessarily a bad thing, because the opposite of being afraid of being active because of discomfort will equal greater problems over time. You'll decondition. That's not a good thing. but everybody's threshold between pain and discomfort is a little bit different. How I define pain is something that you cannot work through. You cannot complete your set, or if you cannot finish the distance that you wanted to run, or if you cannot reach the speed that you wanted to, or the pace, that's pain. And that's your body telling that you're pushing it too much or doing the wrong thing. And so you have to really find that happy medium of a little bit of discomfort is okay, because the greater good is to remain active and exercise. Physical fitness is the number one treatment for so many medical conditions. We could talk for hours about that, but everybody has to be aware. Discomfort, I'm okay. I can keep going. Yes, I feel that. Yeah, I might be sore later, but I can use some Advil or some ice. Pain, no, I cannot complete that. You're putting yourself at risk.
I just wanted to add to that too. You know, with being able to finish, it's being able to finish correctly also with the correct technique. Because there's, you know, you see plenty of people who are like, I finished this, and you're like, ooh, like the technique is terrible. And then that's also going to continue your discomfort and possibly into the into pain and true injury. And even again, you know, the high intensity, like you said, it's ramping it up quickly. But if you're not familiar with the exercises, with the technique, you don't always have to go quickly. You can slow it down, learn how to do it, because you're going to get much quicker gains doing it correctly and learning how to do it properly. And then you'll be, you know, off to the races.
Absolutely. I mean, these are concepts that I wish someone had taught me when I was a kid. I mean, I can tell you, I remember specifically the day where I was, even when I was wearing, on the first day that I bench pressed 225, because that was like a thing, right? Everybody, 2 plates, it's a big deal. I'm sure that I did a terrible job as keeping my form. And that has affected me over time. Now that I spent, you know, a large part of my career taking care of athletes and understanding, I don't care how much you bench if you can't bench it the right way. You can squat 1,000 pounds. If you can't get low enough and maintain your posture, it means nothing to me. And so maintaining appropriate form and learning the fundamentals, there's that one of those catchphrases again, fundamentals, is very, very important.
So I know you touched on this earlier, but how important is flexibility with regards to fitness and injury prevention?
Yeah, I think actually just we're going to roll 2 questions together here because we're just looking at the clock. Let's talk a little bit about flexibility and core strength because they kind of go together. Our core is our fundamental foundation of all of our movements. If you don't have a strong core and you don't have appropriate flexibility throughout the core, I can pretty much guarantee whether you're 13 or 85, that leads to problems. And so, and it's really important to understand that the concept of core is not just your abdominals. I have seen high-level bodybuilders that have a 6-pack like they're a professional bodybuilder. But when you do certain assessments to look at the rest of their core stability, they crumble like a house of cards. I could go on with professional football players and baseball players. It is so vitally important. Core muscle injuries are devastating injuries. Ask Deshaun Jackson. You have to be able to have strong principles of your core. And flexibility is the next layer that we touched upon that earlier as a key component of exercise. Being able to stretch and elongate your muscles over the full length of what they do to contract shifts the force load across. And so flexibility is something just like strength that has to be built over time. Do a little test. How many of you can bend over and touch your toes without feeling stretch in your hamstring? If you commit to that and continue to do it over time, you'll see that things change. That's just one aspect. I'll also put a plug in here for physical therapists. I know there's some therapists on this call. We as sports medicine physicians use physical therapists regularly to try to help people understand the do's and the don'ts. I often say when you're going to physical therapy, I know it's a time and money commitment, but what you're really trying to do is understand where your strengths and weaknesses are. That's what a physical therapist is trained to do. Here's what you're good at. Here's how you maintain that. Hey, guess what? Here's some things that you're really not good at, and if you don't address it, you're going to get hurt or increase your risk of injury. But here's how you address those things. And by creating that priority list that's tailored specifically to your needs, you're really being more effective with your exercise. I'm a firm believer in physical therapy. I wish I had the time to use the knowledge that I have with fitness to be able to impact people in the office, but it's just not possible. I see 30 plus people every day, and to transition from diagnosing after an assessment or continuing to manage and then implement exercise education is just more than I can handle. And that's where my very trusted stable of excellently trained physical therapists come in. So, when a doctor pitches physical therapy, it's for a reason, and it's proven to be helpful. I get a lot of eye rolls, and I have a lot of selling to do, but physical therapy works. Not all physical therapists are created equal. It's really important, just like a lot of other aspects where you have to develop a healthy relationship with a physical therapist. But I am a better person where I am today through working through my adult injuries because I listened to my therapist. I took what they had to say and put it into action.
I love physical therapists. They are definitely a long-term solution to a lot of injuries. Are there particular forms of exercises that are better for patients with osteoarthritis?
Yeah, I will also say one thing with that long-term comment. I'm good at diagnosing problems. I'm good at treating pain, but I can't do the work for people. There is no replacement for the work. And if you don't put the time and effort in, I can get everything perfectly diagnosed. I can get everything perfectly treated as best as I can with medicines, injections, and braces. If you have these problems that are mechanical and muscle imbalance and don't do the work, you're never going to get better. And that's a really important concept. All right. So say that question again. Exercise for osteoarthritis. Yeah.
Yes.
The unfortunate nature of osteoarthritis is the deterioration of material, right? So when I look at osteoarthritis, I really look at the fundamental principles of physics, right? Stress and force across a surface. The more impact you put across a surface, the more likely it is to become dysfunctional and break down. So when it comes to a lot of lower extremity injuries, repetitive impact. So it's really about creating a priority list. Running and walking, every single step you take, repetitive impact that transmits through your foot, through your ankle, through your knee, through your leg, through your hip. More steps, more impacts, more stress across the material. And so runners love to run. I get it. And I'll never tell no one, I'll always say, fine, you want to run? I will meet you where you are, but recognize what you're doing to yourself. If you have a problem for which running will make it difficult. And so the non-impact exercises like biking or the elliptical are designed to reduce the stress across the joint. Now they are repetitive motions, so there are some inherent risks that come with that, but inherently it's less strain on your joints than walking or running. Non-weight bearing exercises, an ergometer, a rower, motion across your whole body, less impact to your joints. Swimming, anything in a pool, running, fitness inside a pool, all things that can be done that can reduce the stress across the joint. A little bit more complicated for shoulder arthritis and things, because unfortunately we don't normally walk around on our hands unless you're a CrossFitter, in which case you might, and you may end up seeing me. But the real premise of shoulder arthritis is limiting force overhead or away from your body. Most repetitive activities at upper body can still be achievable without overwhelming stress across the shoulder. But if you think about these principles and getting back to my concept of diversification for exercise, that's something that if you can put that into action every single day by choosing different things and always challenge your body in different ways, then you can reduce that risk of problems.
Awesome. This next question kind of touches on it's kind of continuation. Do you have any advice on how to prevent injury doing cardio exercise outside?
A lot of times runners will ask questions about the differences of impact across the treadmill or ground or gravel. Differences in surfaces do matter, right? If you're running on a flat surface where your foot strike is going to be more evenly distributed, that's inherently less risky than running on a trail. That being said, we got plenty of trail runners. I think it's important to just understand what your goals are and what your body can handle, and then being able to adapt. There's an incredible shoe industry that exists really to look at, can this shoe be can perform better on a trail versus a concrete surface. But at the end of the day, I think it's really about what your goals are. If you're really just looking to get a quick run in and get your heart rate up, do you really need to go on a trail? I love being outdoors, but if what your goal is to just get some cardiovascular exercise, then running on the road can be fine. But as with all other things, first know thyself. If you are not a trail runner and you try to run on a trail for the first time because it was available for you in the pandemic, you may increase your risk of injury as a new trail runner. And so I think that's something that's really important. Getting back to the fundamental principles of flexibility and strength training is still important, and not mono training. Stretching before and after cardio exercise, I think, can be helpful. There's this concept of dynamic stretching versus static stretching. Dynamic is movement-based stretches, so butt kicks, knee raises, where you're doing repetitive activity but in a controlled fashion to loosen your muscles up. That's typically better as a warm-up. When your muscles are warm after the fact, the static, kind of standing in place and leaning stretches can be much more helpful than doing that when you're cold. So I think those are some concepts that can be easily put into place.
Awesome. So this is a good question. They've all been good questions, but should an active and healthy but aging individuals be concerned about exceeding calculated maximum heart rate for age while exercising?
So the short answer is yes and no. Remember that a calculated maximum heart rate is still a calculated benchmark, right? It's not going to be applicable to everybody. You will have individuals that can greatly exceed, and you will have individuals that may never get to their calculated maximum heart rate. But what I will tell you is this: if you're an aging athlete and you have not seen your primary care doctor or established care with a cardiologist, it don't matter what I do orthopedically if your heart ain't going to support what you're trying to do exercise-wise. So I made some plugs for athletic trainers. I've made some plugs for physical therapists. This is where I make the plug for primary care doctors and cardiologists. Please, 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 if you have questions regarding your heart rate, talk to your primary care doctor. Go see your cardiologist. If you don't have a cardiologist and you want one, I can get you one. I have friends. Heart attacks kill. Knee arthritis does not. I don't think I need to be more simple than that.
Fair enough there. So next one. How can one best determine when a sports injury is serious enough to warrant a doctor's visit?
The simplest answer is, I think if you ever ask yourself that question, you need to see a doctor, right? It's that principle of internal reflection, where if you're doubting yourself, seek expert opinion, which is not Google, and it's not an MRI. An MRI and Google are tools. Tools can be dangerous, right? I have spent years and years and years training to understand the body and understand musculoskeletal things, the same way that a cardiologist has trained for years and years and years to understand heart problems. We are here to provide a service to help you be a better version of yourself. To get a little bit more complex, I'll reflect back upon my discomfort versus pain. If you're experiencing pain because you're being active, that is an indication that something is wrong with your body. If it's discomfort and you feel it, but you can still participate, you may be able to adjust and adapt and then see how you respond. If discomfort doesn't go away over time and you don't have a diagnosis for which causes that discomfort, then you should probably see a medical professional. And then there's the obvious, like if you roll your ankle and it's pointing the wrong way and it's big and swollen, you should seek care. If it's after hours, we got urgent care. If your leg is literally falling off, go to the emergency room. You know, these are one of those principles where we're just understanding what happened, and common sense really should be your primary decision-making tree.
Awesome. And I think we have time for one more question. What do you think? Last one?
I think we get one more. And again, I know some people have submitted some chat questions, but I'm really sorry. We got 3 minutes. I got kids to get home and get in bed, so we're just not going to be able to answer those chat questions. So, you know, again, as we said earlier, we're happy to you know, take office consultations and things like that. But go ahead and let's get this last question in.
Okay, last one. So there has been some evidence of myocarditis after COVID-19. Do you recommend that athletes get cleared from a cardiologist before returning to physical activity after having COVID-19?
Yeah, so the short answer is they need to see somebody, even if they're asymptomatic, because there is risk. And the American Academy of Cardiology and the American Academy of Sports Medicine actually created algorithms for clinicians to be able to guide athletes. If you're an asymptomatic athlete and you test positive for COVID, the recommendation is no athletics for 10 days. 10 days, because you could develop cardiovascular symptoms after the fact. And so if you're a young athlete on this call and you have experienced COVID, I'm glad if you're doing well, but if you're not, just understand that it's still risky and it's something that you should be aware of. If you have friends, let them know. If you have your access to your pediatricians or your doctors, it's real. I don't know if anybody's been paying attention to the news, but an athlete in Western Pennsylvania at the California University of Pennsylvania died of complications related to COVID. It's the first documented death in a young athletic person, and it's a horrible, horrible thing. And so please, 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 athletes, understand the risk. Parents, talk to your children. COVID is real. There are 200,000 families that would argue with anybody that says whatever conspiracy theory that you want to believe. People that are no longer with us, and so please be aware of the impact that this virus has made on society and do the right thing.
Thank you. I think so. I think that was just about perfect timing there for our hour-long question and answer. Anything final to say? Thank you, everybody, for joining us tonight. Jen, anything else to add?
No, I think this was awesome. You guys did a great job. And again, thank you, everybody, for joining. I did put our contact information in the chat box if anybody's interested in scheduling an appointment. We also will send out the recording of the lecture and also a follow-up email with some information on Dr. Stache. If anybody is interested, we'll probably send that out tomorrow, the recording as well. And you can feel free to pass that along to anybody that you feel may benefit from this. But we hope you enjoyed a lot this evening. I certainly did. So thank you to Jess and Dr. Stache. I appreciate all your help with this.
Thank you.
Everybody be safe. Take care. And in November, go vote.
Thank you.
Thanks, everyone. Have a great night.
Thank you. Have a great night.
Thank you. Have a good night.
Thank you.
Thank you.